Welcome to discussion of the new National Housing Federation and Housing LIN research, supported housing for people with long-term care and support needs. As Lois said, this is the third of what will be a series of happy hour sessions over the coming months. Unfortunately, we have, for obvious reasons, had to cancel our usual programme of regional and one-off events, of which this research would have been a key session. But we're delighted that so many of you have been able to join us today, where we're hoping for over 50 people to be here. 4 weeks ago, the NHF and the Housing LIN jointly published our new research about supported housing for people with long-term care and support needs. The links to the research on both our site and the NHF site are on the slide if you haven't had a chance to download that yet. We're conscious that there remains strong and continuing interest in developing supported housing, but also that there is a need for a more sustainable policy and funding model for developing long-term supported housing in the future. We also know from our recent discussions with both housing providers and local authority colleagues that supported housing has, in the main, been effective at helping to keep tenants and vulnerable people safe. So this research comes at an opportune time. We're delighted to have with us today Sue Ramsden from the National Housing Federation, Claire Skidmore, previously of the Housing LIN and now with NHS England and a co-author of this report, and Alan Millward from MHCLG. Particularly happy he's here today in the context of the work on the spending review that's taking place right now. And all of them will talk us through this research, the recommendations, and MHCLG's perspective about supported accommodation in England now and into the future. Once they finish their presentations or talks, we'll commence the open forum, which Lois has just kind of outlined to you, where you'll get a chance to ask questions or comment. So we hope you find today's session interesting and useful. And I'll now hand over to Sue to set out why the NHF commissioned this research and why it's important to their members. Thank you.
Thank you, Ian, and good afternoon to everybody. My role is really to say something about the context that supported housing providers are kind of working in, and answer that question that Ian just asked: why did the Federation kind of commission this work? So the context kind of overall was around a kind of sense of the declining activity of traditional housing associations in the area of developing schemes for people with long-term care and support needs. So we wanted to look at why there had been this change in the market, and why some traditional providers were no longer doing work that perhaps they had done 5, 10, 15 years ago. And I think it's worth remembering that, you know, housing associations are really the backbone of supported housing development in this area. And the kind of pioneers in terms of a number of different models of independent living and really promoting alternatives to residential care for people with long-term care and support needs. We still have over 70% of the supported housing sector is owned and managed by housing associations. They're still really, really important in this market. So this research was particularly look at why there'd been a decline in new development in the kind of recent past. So the kind of context that we knew that people were working in, now the kind of environment in terms of changes in support funding, changes in grant levels, changes in income levels for housing associations as we came out of a period of 4 years in which social housing rents went down year on year, and obviously questions around local authority funding in terms of care contracts as well. So that kind of broad environment that people were working in. And then what we also were conscious of was some quite specific questions from the regulator around the risks associated with some new providers who have come into the sector and use a lease-based model for provision. And we have seen expanded supply, you know, certainly from that sector, but also some important questions from the regulator of social housing around some of the risks associated with those financial arrangements. And I think lastly, the kind of really important kind of context for the sector was some questions from local authorities and from service users and families around what housing associations were able to do, how flexible could people be in terms of responding to people's kind of individual needs, the kind of particular demands around the Transforming Care programme and that ambitious idea that it is possible to move people from quite institutional forms of care into more independent living within the community. So I think some real challenge to the sector around some of those questions from commissioners and from the NHS. So the research questions that we looked at, and these are just listed on this slide. We wanted to look at what the significant barriers were. We wanted to ask local commissioners around what their needs were, how they felt housing associations were able to meet those needs, and how the two partners could work together in terms of a sustainable model for development. We also wanted to kind of piece together the different parts of the jigsaw and involve the regulator in those conversations. The regulator has a particular role around rent setting for supported housing, as well as an overall responsibility around governance and financial arrangements for housing associations. And then comes the question of development funding and the grant that is available and the different funding streams that there are available. So the kind of question of how that capital funding from Homes England, from the GLA in London, and the overall kind of policy of MHCLG, kind of where that fitted in to the jigsaw. And then finally, kind of the question of oversight of schemes and particularly around costs and quality. So those were our kind of key research questions that we gave to the Housing LIN. And I just want to, I mean, Claire's going to talk through the detail of the kind of findings in the report, but I just wanted to kind of draw people's attention to the case examples that are in there, and we talk through the story of the development of a number of different supported housing schemes, including some costings, rent levels, grant levels, capital funding, and it's a kind of small snapshot and some insight into the kind of complicated package that needs to be put together in order to build a successful supported housing scheme. A couple of the schemes were very much developed in part as alternatives to residential care, and on the back of the closure of residential care schemes. So that whole process kind of start to finish, which can take years. And I think there's some, it is really only comes to light when you look at that in the light of particular scheme and kind of develop an understanding of exactly what's needed to develop a successful scheme. I would also particularly draw people's attention to, if you, in the report, click on the link for the 13 group example, which is a scheme in Loftus up in the northeast of England. And there's a YouTube video there from one of the service users who lives in that scheme. And he does a really kind of good job of bringing to life the importance of supported housing and the difference that it can make to people's lives. So Ian's kind of last question to me was, how will the Federation use the evidence that's set out in this report? Firstly, I think, and this is where the strength of those case examples comes in, we will use it to promote supported housing and the need to carry on developing a sustainable model of supported housing and encourage the different partners that are needed across that jigsaw in order to increase the supply of supported housing in the long term. And that is for us at the Federation about a conversation with all the different partners and bringing those different partners together so that there's a better understanding of that each has a role within that complicated jigsaw. We can't do one piece and forget about the other pieces. It doesn't, it falls apart if that happens. And certainly I think one of the problems that providers have had over the last kind of 5 years or so is in dealing with what has been quite a fragmented system in terms of the range of different funding streams available and the way that you put together that package and local partnership around the development of the scheme. So that's how we will use the evidence and the recommendations in all our conversations with all those different partners. It's there in our comprehensive spending review response, which I think government still has a number of long-term decisions to make around housing investment and around health and social care, and I think this is a government that still has a degree of ambition that I think we'll hear from Alan about in terms of supported housing, and there still is some I'm hoping positive news to come. We've already seen the AHP announcement with a clear commitment within it around grant funding for supported housing. So I will pass you over on to Claire, or maybe it's back to Ian, or maybe it's on to Claire.
Yeah, so that's thanks very much for setting the context there, Sue. I think Claire's going to talk us through just a bit about effectively how these research questions were addressed, but primarily the evidence, the recommendations that come out of the evidence base, and then perhaps a bit from Claire's new perspective in her NHS England role. So Claire, thank you.
Okay, thank you very much. So yes, I'm currently the National Housing Lead in the Learning Disability and Autism programme at NHS England, and I've been in that role for 2 months. So prior to that, I was at the Housing LIN, and I undertook this piece of work on behalf of with Ian for the National Housing Federation. So I think first of all I want to describe the approach that we took to the research. What you see in the report emerges from many discussions that we had with, I think in total 43 National Housing Federation members across a number of forums and focus groups, and that included those specialising in supported housing and support providers. We also spoke to MHCMV, regulator, CQC, NHS England and Improvement, Homes England, and we also were fortunate to be able to draw on discussions that we were also having at the same time with commissioners as part of it's research that we were undertaking on a very similar theme from the point of view of commissioning and planning, to understand the key concerns and objectives of commissioners, and we also were able to speak to some people with lived experience who were able to tell us what was important to them in terms of their housing and their supported housing. So all of that culminated alongside the desktop review evidence that we undertook to mean that we actually had a rich kind of array of evidence which created the picture that you see in the report. So it wasn't a Housing LIN view, it was a research report based on that evidence, and I think particularly from the perspective of National Housing Federation members. So in terms of the findings, obviously please do read the report in detail, but the headlines were around the importance of the 3 core areas or pillars of funding which need a sustainable long-term footing, and that's around the capital costs, the housing related costs and the support costs. So that's probably the most important finding in the report, and there's quite a lot of detail underneath that in terms of what Federation members in particular were telling us would really help them in terms of reducing barriers and so on. Alongside that, there was a need for a proportionate sector-wide oversight regime So welcoming the oversight, the potential of an oversight regime, but with a focus on outcomes for people, but also full transparency of the real costs of delivering long-term supported housing. And that was something that really came through very strongly, was wanting funders to have an understanding of why good supported housing does cost more than general needs housing ultimately, and why that needs to be recognised in the way that it's funded. But also the importance of local authorities and strategic partners developing a clear shared understanding of need, and a shared strategic approach around planning and commissioning for supported housing. That was something that came through really strongly in the research we did for the National Housing Federation. It was also probably the overriding theme in the work that we did, talking to commissioners as part of other research as well. So that was really strong finding. I could go into more detail, but I just wanted to briefly touch on why this issue is really important to NHS England improvement in my current role. I mean, we do have a particular focus on enabling people with a learning disability and autism, often with the most complex needs, to access good housing options. So clearly that's the role of supported housing is absolutely essential underpinning to that. And a major focus is on enabling people to leave secure inpatient hospital settings. And I was really interested and pleased that some of the case studies at the end of that report do kind of explore some really good outcomes for people who might otherwise have been in secure settings, as well as those who might otherwise have been in living in residential care. So, I mean, clearly housing solutions are much better for people's health and well-being, quality of life with the right personalised support and planning, and that's a really core commitment. So we work to deliver our housing capital programme, which is mentioned a few times in the report, and there is some really valuable feedback and detail in the report and in the case studies actually about that programme. So I think in my new role that's still very much of interest. And our capital process can be complex, but we aim to support local areas as much as we can to plan for and make use of that capital funding alongside all of the other funding solutions there are. I just wanted to say that beyond that, we are keen to offer support to local systems to help improve planning, and that's a really important part of both my work and also the work of the regional housing leads who work across the country to work with commissioners and providers. And I will put in the chat function my email address if anyone wants to get in touch. So I mean, I'm new in post. I'm definitely here to learn as well. I do have an opportunity to influence other NHS England improvement work streams around the role of housing in personalisation, commissioning support, and of course supported housing in all of that. So I'm keen to hear from. So Ian did ask me to mention what would be really useful to kind of hear from you. You're great examples that we can learn from, but also examples of where there are barriers, perhaps some of those that kind of explored in a report, as well as others that you might have experienced in terms of providing housing options for people, particularly, obviously I'm focused on people with learning disability and autism.
Great, thank you very much, Claire. I see Alan has joined us in person, fantastic. Really pleased to have Alan Millward from MHCLG. We've had a lot of conversations with Alan and his colleagues over the last few months. So I'm just going to invite Alan just to, I suppose, give us a kind of government perspective around supported accommodation at the moment. Alan.
Thanks, Ian. Can people hear me okay, or am I breaking up? Great, thank you very much. Good afternoon, everyone. I'm really pleased to be present today, to have this chance to give you an overview of the government perspective on supported housing. So again, just to introduce myself, I'm Alan Millward. I'm a policy official in the Housing with Care and Support Division, based in MHLG's Social Housing Directorate. I'd like to thank Housing LIN and the NHF for this chance to be here. We're always keen to engage with the sector and local government on housing support issues and to get a chance to hear views from practitioners at the front line of delivery. So, of course, supported housing helps a wide and diverse range of vulnerable people, and the sector's work underpins wide-ranging government policy across housing, health, social care and welfare, being developed by a number of government departments. So it may help if I provide a quick reminder of the government's role in supported housing with a landscape that goes across a range of departments and bodies. So MHCLG has joint policy responsibility for supported housing in England only, together with the DWP housing policy team and with the Home Office on domestic abuse refuges. MHCLG, again in England only, also leads on policy on local housing support services and on capital funding for new supply of supported housing through the Affordable Homes Programme. DWP has policy responsibility for supported housing with MHLG and leads on housing benefit policy. The Department of Health leads on government policy on key issues such as mental health, autism, learning disabilities, adult social care for older people, with many people in this area in receipt of supported housing services. MOJ, the Home Office, DFE, MOD have key interests in supported housing for ex-prisoners, people with substance abuse issues, for care leavers, for homeless veterans. The regulator for social housing is the independent regulator of registered social housing providers in England, including for housing services provided in supported housing settings. And the Care and Quality Commission has oversight of care in CQC registered extra care and supported living settings. Our ministers at MHCLG continue to value the important work of supported housing in helping hundreds of thousands of some of the most vulnerable people in this country to live independently and with dignity, and often helping them to give improved life outcomes. We have a new minister at MHCLG now called Kelly Tolhurst, with lead responsibility for supported housing, and she is already taking a keen interest. So moving on to COVID, MHCLG ministers and officials were extremely appreciative of the social mission and commitment of this sector, and in particular frontline staff, in continuing to deliver really vital supported housing services to vulnerable people during the first wave of the pandemic and lockdown. And we also valued the work of the sector in helping to keep officials updated on the sector's efforts to respond to the pandemic. And we remain keen to stay close to the sector and to work closely with the Department of Health as regards the sector's preparations and readiness for what the autumn and the winter may bring in terms of COVID. Probably helpful if I next emphasize that oversight of quality continues to remain an important matter for our ministers, though we are always mindful, of course, that the vast majority of providers are working with commitment and a clear sense of social mission. But our ministers are clear that all supported housing provision across the whole sector, so not just the provision provided by the kind of committed providers like you who attend events like this, must be of good quality and must meet the needs of the vulnerable people it supports. We have undertaken extensive engagement with the sector and with local government over last year and the early part of this year. And this in particular has helped us to frame our policy development, for example, through the input we've received from the sector in helping us to develop the proposed new National Statement of Expectations in Supported Housing, which is often known as the NSE, which we expect to formally announce soon. To elaborate a little further on the NSE and to give a little bit of a flavour, especially for those of you that might not have been involved in helping to develop it, this will be a form of voluntary guidance. We recognise the breadth and the diversity of this sector, so the NSE guidance is going to be at a very high level. It will emphasise some best practice in terms of commissioning, strategic planning and delivery standards for supported housing, as informed by the discussions we've had with the sector and local government beforehand. The expected audience for the NSE will be local authorities, providers, other local partners and other wider stakeholders. The NSE is going to emphasise the importance of joined up working, partnership and integration. So, as I said, we expect to formally announce it soon. Again, on oversight, we and the DWP have also been engaging with local authority housing benefit teams and with supported housing providers too on how we can make the housing benefit system clearer and simpler for all. So, in emphasising the importance ministers place on improved oversight and strengthened oversight of supported housing, however, I should also just say that a key consideration that we also keep in mind is the need to take a balanced approach and to be careful about what burdens we might be placing on hard-pressed, responsible providers so that the supply of good quality supported housing is available to the people who need it. So we will, of course, continue to work closely with you and with local government and to listen both to the sector and local government on how we can collectively maximise the potential for supported housing. So thank you all for your time in listening to me, and just to say again, thank you to Housing LIN and the NHF for this chance to engage today, and looking forward to the questions and answers a little later.
Great, well, thank you, Alan. It's actually Q&A time now. So if anyone has got questions they'd like to pose to Alan, Sue or Claire, then please indicate that through the chat function to Lois, or indicate to Lois through some other means, and we can either read out your question or you can unmute yourself and pose your question. Whilst you're having a think about questions you want to ask, Sue, I wonder if I could just kind of raise with you. I think one of the interesting recommendations here was around funding for support costs as distinct from care. Essentially, this was, although Alan's given us a very broad kind of sense of potential policy around supported accommodation for lots of different groups of people, this was around people who've got long-term care and support needs. A clear message back from many Fed members was that lack of funding for support as distinct from care has been a key barrier to development. I just wondered if you could just say a bit more about where you think that's coming from, because that's not a new message. I think that's been brewing for quite some time, and how significant you think that is in terms of a lever to unlock more development of supported housing by housing associations and NHF members.
I think it's absolutely key. If I think back to the work that we did with members back in 2016, when we were looking at the prospect of a local housing allowance cap and difficulties around benefit levels to cover the rent, and we had some very detailed discussions with members then about the consequences of that cap. What came out really strongly when we surveyed people around their appetite for development was, well, yes, that cap was a problem, but there was also a very significant issue around support funding. And that issue is that exactly the same issue today. And what government delivered was a degree of security around revenue funding for rents and the kind of basic housing costs. But what we don't have is any degree of long-term security around the revenue funding for support. We've got significant cuts in what was the Supporting People programme in terms of local authority spending around housing related support. And I think if you asked people what the biggest remaining barrier was to their appetite for new development or even managing and maintaining existing schemes, it is that problem with the support element of the service, how that can be funded, how local authorities are able to give some degree of long-term commitment around support. We are talking about a client group that has long-term needs, and therefore we do need that long-term commitment around support. And the support is something that's very different from a care service. The support is very much around an individual needs and independent living and their ability to maintain their own tenancy.
It'll be interesting to hear other people's views about that, because you mentioned supporting people, and I think it was made fairly clear to us in conversations with people at policy level that if there was to be such a kind of new revenue fund, it wouldn't be supporting people Mark 2. And then the question arose as to if there was going to be funding for support, how would providers get that? Would it reflect what happened sort of 15 years ago, that local authorities had that money, or would it perhaps go back to an earlier model of where housing associations got that money direct from what was then Homes England's predecessor, the Housing Corporation, through different forms of grant? Be interested to know what people think about that, because that would be quite a radical departure. And I don't know, Claire, if there's anything, sorry, Sue, if there's anything you think, you know, what your sense of what your members are saying about that is.
I think certainly members say that, particularly with long-term services for people with care needs, there is it's really important that local authorities are involved in those commissioning decisions. You know, that really is a local partnership. So whether the funding comes through the local authority or whether it comes through some kind of direct funding to the housing provider from a kind of national fund, I think that the important thing for housing providers is that money is ring-fenced for support. And I don't think people do want to recreate supporting people, but we do need to learn from it. There were some very positive things around the Supporting People programme. You know, there were also, like most things, some problems and negatives. And I think there is an issue around the fact that it was just quietly dismantled over the past 10 years and starved of money. And we just, at the moment, kind of beginning to understand some of the consequences of that.
Alan, I wonder if are you still with us, Alan?
And I'm unmuted now, I think.
Yeah, okay, thanks. I mean, I'm conscious you probably can't say a huge amount, but you kind of referred to what sounded like reading between the lines, the need for an oversight regime, which may or may not be linked with any additional funding, and I'm sure you can't disclose any of that at the moment. But I just wondered if you could say a little bit more about what are some of the considerations at a policy level in government around what oversight might look like. You know, a new oversight regime for supported housing. Is there anything else you can tell us about that?
So I think the most important thing I can say at this stage is we are incredibly conscious that whenever we do policy formulation in connection with supported housing, because of the diversity and complexity of the sector, and because of the sort of the vulnerable cohorts that you look after, that we need always to take it slowly and stage by stage and talking carefully with the sector itself. So I think what people are going to see as we take forward our next announcement on oversight, which we hope to be pretty soon, is that they will see that it's a staged approach, and then we will see how that works, and then we will take a further view at it. And again, I think people will see that's the same way the DWP have been approaching sort of their look at housing benefit. So they've been talking very much with local government and with providers, again, trying to involve the sector in what we're doing as much as possible, rather than coming up with highfalutin grand schemes and just announcing them. Um,
I mean, one of the kind of three pillars that Claire referred to is funding for housing related costs, and obviously the previous government made clear in 2018 the ongoing kind of commitment to housing benefit funding to meet those costs. Are you able to give us a bit more of a flavour of what DWP might be saying around housing benefit?
That's quite a difficult question. They're not planning anything radical soon. Again, they're taking a staged advance with this. Obviously, they're still rolling out universal credit. So again, I think at the moment it would be fair to say DWP are taking this slowly as well.
Okay, so
that's probably the most I can say.
Yeah, okay, that's a fairly understandably cautious answer, but I think my interpretation of that is that we're not going to see an unraveling of what's been previously committed. I don't expect you to answer that, but that's kind of, I think, the sense we got through doing this research, which feels reassuring. The other kind of third pillar of this that Claire referred to was around capital funding, which was focused around, essentially additional capital funding through Homes England to be dedicated towards supported accommodation. And Claire, I just wondered if you mentioned a bit about NHS's capital programme, which has a different kind of governance structure and quite different technical requirements for housing providers. I just wondered if you could say a bit about how maybe those two capital funding streams possibly could be better aligned, possibly through some of the emerging kind of ICS arrangements between the NHS and local authorities at a local level.
Well, I think the first thing to say is that we are in ongoing discussions with colleagues in the Department of Health and Social Care around how we could better work together in the long term. And I think that I don't want to give any kind of go into any detail about that, but I think we all recognise that there are ways in which we could align that. I think in the immediate term, but I suppose myself working with the regional housing leads who are based across the country, a really important part of our work is around actually working in quite a lot of detail with people at a ICS level, and still with some of the TCP arrangements systems that still kind of functioning, and with local authority partners who are a really important part of that kind of commissioning system, to understand the need locally and to understand how we can kind of plan better. And part of that is definitely about looking at not just the NHS England improvement capital, but about all of the capital options and understanding all of that better. And I think we, as a team, we definitely aspire to, in practice, a lot of certainly my regional colleagues' time is absorbed in very practical support for people to access and to make use of the housing capital funding from the NHS England. And I think looking forward, we would all aspire to obviously continue to do that, but also the regional housing leads have always had a key role in terms of supporting national policy development as well as work in their area. And obviously I'm in post, I'm going to be doing that a lot more as well. And so we would like to have a broader conversation with people than perhaps sometimes we always have time to do, about how we can best support them in that area, which is looking at all of the funding options and working closely with ADAS and the LGA around where is there opportunities to offer a collaborative, supportive approach that might be around highlighting, kind of working with colleagues like the Housing LIN and others around what are the really great examples of practice, how can we support people to access that intelligence. But also, I mean, I was going to give her an example of a really practical example of how, about some of the influencing, where some colleagues will be aware of the dynamic support registers that are being developed at an ICS level to support better planning for people who are at risk of admission to inpatient, sort of secure inpatient facilities. So really talking about this sort of high risk group that we've really focused on. And clearly it's really important that housing is seen as a really important part of the needs that are being looked at through that dynamic support systems. And that's something that we're looking at how we can influence practice nationally and support people locally to build that in, because it's any housing colleague will know that it's about, if a sustainable supported housing is to be developed, it's about thinking about that right from the very beginning, almost thinking about that almost first. So that, I suppose, there's a kind of policy aspect, and there's also really practical sort of nitty-gritty conversation that we're really keen to be part of and support locally, which is why I'm encouraging people to get in touch if you would like to have a further conversation about capital, but also about the broader programme and how we can kind of support that in other ways.
Okay, great, thanks. I can see Mike from Keyring, Mike Wright, posed a really interesting question in the chat room. And Mike, rather than me interpret that, do you want to kind of pose that question yourself, and who you'd like an answer from?
Yeah, well, anybody will do, in terms of the answer from. So I work for Keyring. So I guess the biggest impact that we've noticed in Keyring during the period of austerity is not the lack of funding. That's obviously not been fun by any means, but it's the reduction in choice that's happened during that period. So to give a specific example, Keyring is consciously not CQC registered, but we work with people in supported housing and supported living to help them move and become more independent, to have community connections, to move beyond that sort of more institutional group session. And it helps us in terms of our focus, but also the perception of that person we're working with. Increasingly, we're coming across local authorities now who are setting up DPSs or other frameworks that specifically state that you have to be CQC registered to go on their supported living DPS. Now, that is not true. I've checked it with the CQC. Supported living isn't a registrable service. What you do in a supported living might be registrable, but it's not. So immediately, and in fact, the one I was having a discussion with, I said, well, what do you do if you have lots of choice to give to people on this DPS? And he said, well, actually, we've never had choice for people who only ever had one provider in every time we've offered something. I thought, well, there's you're wanting innovation, and yet you're putting a restriction in. So my question was, how do we address that? How do we move away from the sort of more unilateral and more the tighter and tighter service specification and so on that have been emerging? And actually, for me, to go back to who used to fund Keyring for about 95% of its work, which was supporting people, which was much more outcome-based, much looser, much broader. So I wouldn't mind supporting people Mark II, to be honest.
It'll be, there's quite a few colleagues from local authorities tuned in, so it'd be great if maybe one or two of them wanted to provide a response to that without me picking on anybody. Perhaps one or two would like to volunteer. Whilst they do, Sue, I wondered if that is that an issue that you find is coming back through Fed members, so housing associations? Are there registration issues there that are kind of maybe confusing care and support, that are something that crops up?
Yes, I think this confusion exists at a whole range of different levels, and I can think back to, in fact, it was the moment in which I think I probably realised that we needed to commission this research, which was a meeting that Claire ran as part of the work that she was doing with the LGA, in which she brought the different partners together to look at the issue around supply. And we had the CQC, and we had the social housing regulator, we had carers and service user representatives, and local authorities and housing providers all together in a room. And I think I was really struck by how little we understood about each other, and particularly the different role of the regulators that touch on kind of housing provision. So the kind of question of the CQC role, the question of the regulator for social housing kind of role, and the need for something that is much more joined up around making sure that we are able to offer, what Mike was talking about, that degree of housing choice for people. So I think it exists at all levels. And if I was going to offer a solution, I'd start with talking to each other a lot more. Stop talking to each other and start kind of broadening out those conversations and talk across the piece. And I'm hoping that is going to be one of the outcomes from this research, both at kind of local and national level. If we each had a better understanding of our relevant kind of roles in this, then I think things would work a lot more effectively. I also think there's been a real problem with government's kind of overall ambition around greater oversight across supported housing, and the delay that there's then been for the reasons that I think everybody knows about in terms of actually bringing forward those proposals. And
Sorry, hi Sophia.
We'll be in a better place when we do have those proposals.
No.
Julie, is that?
Oh, well, don't worry. I was going to ring you at 5, so we might as well have the conversation now. It probably, I'm just a bit worried that I might be on speaker. Can I just come off my meeting and then I'll give you a...
All right, I don't think Julie was talking to us. Okay. Alan, I wonder if we could bring you back in here. I wondered if this issue that Mike's raised, whether there was the National Statement of Expectations, I think, is going to have some case studies in, if I remember rightly. And I wondered if this was something that, if there weren't any case studies about this particular issue, that was something that you could take away.
Certainly be really interested to hear more about it from Mike. I confess, it's the first time I've heard of this issue. That's the amazing thing about supported housing. Every single day is a school day. You're always learning something new. So yeah, we'd be really interested to find out more about that. It's too late for the NSE that we're just about to announce now. That's locked down. But it's not. It's tended to be a document that's going to be there for a long time, and so we'll be keeping it under review without committing to anything right now. But it's certainly an issue we'd like to understand and hear about more. So certainly our intention is that local authorities should be commissioning in the most sort of innovative and thoughtful way possible, and they shouldn't be shutting out potential bidders for contracts through perhaps taking it not the widest sense of views they could. Again, there may be people on the corner or local authorities who understand this better than I do. I can understand that obviously many local authorities might want to. A lot of their commissioning might be very focused on people with acute needs. That might be why they're more focused on having CQC registered providers. There may be different aspects to this I can't understand yet.
I think, well, Alan, if I can say, I just think there is, there isn't anything that needs to change. It is the interpretation of what's around. It is at different levels, which is the factor. And let's be fair, from the moment austerity started hitting, the local authorities took the first hit. So their capacity to deal with complexity and stuff like that, was hit quite hard. So you could, yes. I can understand to some degree where they might take a simpler approach to things. However, that simpler approach isn't producing the best outcome. So this is not a hit on local authorities, but it is an issue. And you could say the same in terms of commissioning. Far too much I think is tendered than needs to. However, what capacity have social care commissioners in local authorities got to understand complex commissioning processes when they've got half the team they had a few years ago? So there's something about perhaps government recognising that their aspirations are being either interpreted or impractical at a local level, and that's the local level we're dealing with.
Great, thanks, Mike. I'm going to bring in Laura here, Laura Harper, who's very kindly offered to give us a local authority perspective on this. Laura.
So I'm actually on secondment in public health at the moment, so I've been desperately going through my archive files to check that on our supported living framework we don't have a requirement for CQC registration. I'm very pleased to say that we didn't, and that was particularly working with colleagues at Keyring to ensure that we were able to offer that choice and control to people who were funded through adult social care. And we have a very successful keyring scheme in Lewisham, which doesn't always doesn't require people to be funded through social care, but obviously now can allow for that. I wanted to just reflect a little bit on some of my experience getting schemes off the ground in Lewisham, particularly at the sort of pre-planning stage and feasibility. And one of the challenges that I've experienced both with extra care and learning disability supported housing through the NHS Transforming Care programme was the reluctance or the difficulties pinning down housing benefit colleagues within the local authority around what an appropriate level of funding that we could apply for those, particularly those support costs and housing benefit, getting the clarity around what could be considered housing benefit eligible and what needed to be paid for by care where a care package was being put into place. And I think that for me, that's working within an organisation with colleagues who I've known for a number of years and with examples of schemes that they've agreed for. So there's a precedent and an ability to kind of draw on that to reach some conclusions. But I've had numerous conversations with housing benefit colleagues where they've said, come and talk to me when it's built. And in order to get the thing built, we have to evidence that there's sustainable revenue streams for that. And I think that it's really just to reiterate the challenges faced at a local level by the lack of clarity and transparency from the numerous government departments, central government departments involved in this process. And I think that if, I would welcome more clarity around much as provider colleagues have already expressed that need for clarity around funding streams. And I feel like it's a bit of a lone voice. Sometimes you feel like the only person in the local authority that can understand both care and support and housing funding and development. And I would love to be able to give somebody, and around extra care, there were quite a lot of great reports over the years that were a bit like a step-by-step guide to developing extra care. But I would love to be able to give housing colleagues and other colleagues in adult social care and commissioning the step-by-step guide to getting this right, and it just doesn't exist, I don't think, yet.
Great, thank you very much. I'm conscious we're getting close to time. I see Nick Sedgwick from Anchor Howe has just put something in the chat about the supported housing sector scorecard in terms of oversight, and Alan made the point that government accepts that the vast majority of supported housing providers are doing a really, really good job. Nick, I just wondered if you wanted to say something very briefly about what that is. Not everyone may know what it is and how you use that at Anchor Howe.
A large number of housing associations contribute to the main sector scorecard, which is a high-level way of comparing costs and performance across housing providers. The difficulty is using that for more specialist providers, or being able to cut that data to show how you perform on your supported housing. So a group of providers got together, supported by the NatFed last year, and we piloted how we might be able to produce that data for supported housing. And this year we're rerunning it again and are asking as many providers to join us as possible, so we get a good basis of data to allow good comparisons for those metrics across supported housing.
Great, fantastic. I can see we're just getting a few more questions flying in as we're coming up to 5 o'clock. So other people, you can all see those. Thanks, Dawn, for that comment as well. Just as a final one, perhaps this is one for Claire. Claudette McDonald from Bristol City Council. Claudette, do you want to just pose your question? Because I think it applies in quite a lot of other areas as well.
Hi, yes, I'll do that. So it's really around the NHS funding. So I know that there's a couple of schemes in Bristol that have got ring fence funding, but the property may not be so appropriate for further supported housing. Obviously, there's a bit of a circle where people either come through the housing route or they go through the adult care, social care route, and how we can, and if those properties were to be disposed that have NHS funding, is there any thoughts about how that capital can be reused within the local authority area rather than it going into the national pot, and also be reused to, in some ways, do a bit of preventative work and also, you know, help those that may or are actually on the trajectory to go into through the route of adult social care into supported housing. So it's just really a thought, it's more like pooling all our resources really and trying to do some preventative work to ensure that obviously we don't get to the later stages where we're having to go to TCP, transfer and care pots of money to kind of do that preventative work. So it's just really a general question, or if there's any thoughts around that really to Claire.
Great, thank you, Claudette. Claire, just briefly, any thoughts?
Hey, I think it's a very timely question. We are just embarking on a piece of work to really get to grips with all the properties on our list which have NHS charge on them, and it's a big piece of work. I mean, I think the short answer is at the moment we don't really have that flexibility that you're talking about. I totally understand your reasons for asking, and you know, it's something we get asked about a lot, and I totally do understand why that is. But at the moment, there is this focus around this particular cohort of people with, you know, we still have these targets around helping people to get out of hospital and not be admitted to hospital, and you know, we haven't met those targets. So kind of it's all hands to the pump really in terms of really trying to kind of achieve good outcomes for that group. And so that isn't to say that other groups aren't also really important, but in terms of government priorities and sort of the at the moment the policy around the use of the grant, that is its focus. That said, I think that certainly the housing team, I hope I can speak for other colleagues to say that we're very interested to hear that feedback, and particularly around, as I say, in terms of, you know, how the grant can be recycled, because we're very much in the middle of this review, and you know, there may be opportunities for us to kind of influence and to have conversations about some flexibilities in the future. I mean, there's always room for a conversation. So thank you for the feedback, and I think I do understand why you're asking that.
Okay. Sorry, Claire, I may be in contact with you because there's quite a few of these properties in a similar, as I've just given as an example, in Bristol.
Oh, I'd love to hear from you.
Yeah.
Yes,
so, I've got your email.
We're going to be it's very timely. Yeah. Can I just quickly say something else? Just reflecting on something Sue said earlier about how this can be a very complex area and kind of multiple partners not necessarily always fully understanding each other's perspective on this. It's just reminded me of a piece of work that we did when I was at the Housing LIN for NHS England and the LGA, which is I'm now taking forward in my NHS England an improvement role, which is a piece of guidance to support commissioners to kind of understand, make sense of, and manage the kind of issues around the specialised supported housing lease-based model. And that piece of guidance will be published this autumn, and we're going through the publication process at the moment. Just want to flag that.
So that may be the topic of a future happy hour. So I'm conscious we're over time, so I'm going to wrap up now. Thank everyone for coming along today. I think we found it useful and interesting. Thanks particularly to Sue from the Fed and Claire for their contributions, and particularly thanks to Alan for coming along today in the midst of the spending review. I think reading between the lines, it sounds like there is likely to be a forthcoming national statement of expectations published in the not too distant future. Just to let you all know, we're doing these sessions on a weekly basis, I think, Lois, up until the end of October. Yep, so please keep a lookout on our website and our social media channels. The one next week, the happy hour next week, I think will be at the same time, Lois, Thursday, 4 o'clock. Coincides with International Older Persons Day, and we've got a couple of leading academics who will be sharing their insights into ageism and featuring a new campaign that we've signed up to called Stop Ageism. So I hope that's relevant to lots of you, and you'll come along next week or to future sessions, and we'll see you at the Happy Hour bar in the future. But otherwise, thanks very much for coming today.
Thank you, everyone.